Hello and welcome you all. This is Naseer here. Dear student, our today topic of our discussion is cell wall inhibitor. In our previous lecture, we were discussing about drug acting on cell membrane or cell membrane inhibitor. But in today's tutorial, we will discuss about the cell wall inhibitor. So, what is cell wall inhibitors? Those drugs which act on the cell wall of the fungus or fungi is known as cell wall inhibitor. Simply, we people consider that those drugs which target the cell wall of the fungi, which disturb, which interfere with the synthesis of the cell wall inhibitor is known as cell wall inhibitor. For example, Capsofungin, Micofungin, and Anidulafungin. So that's the introduction of the cell wall inhibitor. And the most important example of the simple cell wall inhibitor is the Capsofungin, Micofungin, and Anidulafungin. But in our today tutorial, we will only discuss about the Capsofungin. So what is Capsofungin? Capsofungin is a first and prototype of echinocandin. Actually, the Capsofungin are belong to the echinocandin antifungal drugs, and echinocandin are a class of the antifungal drugs which act on the cell wall of the fungus cell. And this Capsofungin is a first study echinocandin drug and have an prototype of the echinocandin. It means that the Capsofungin represent the whole class of the echinocandin and work by inhibiting the cell wall of the fungus. Actually, Capsofungin inhibit the cell wall synthesis of the fungus, leading to the weakening and final death of the fungus, and use against those fungi which are resistant to azole antifungal drug. And we people can use Capsofungin in those condition or for those fungi which are resistant to azole antifungal drug. So when azole antifungal drug doesn't work against the fungi, so in this condition we can administer Capsofungin. For example, Candida and Aspergillus. So in the infection of the Candida and Aspergillus, we people can administer the Capsofungin for the treatment of such a type of infection, because these infection are resistant, or these fungi are resistant to the azole antifungal drug. So in such a condition, we people can administer the Capsofungin antifungal drug. So that's the general introduction of the cell wall inhibitor and Capsofungin. Now move forward toward the mechanism of action of the Capsofungin, that how Capsofungin antifungal drugs work against the fungi, or how Capsofungin inhibit the synthesis of the cell wall of the fungus. So it is a echinocandin class of antifungal drugs that interfere the synthesis of the fungal cell wall. In the mechanism of action of the Capsofungin, you people should remember just 2 points. The first one is that Capsofungin is a echinocandin class of antifungal drug. And how the Capsofungin work? That interfere with the synthesis of the fungal cell wall. Capsofungin inhibit the synthesis of the fungal cell wall. How? By inhibiting synthesis of beta-D-glucan. This Capsofungin inhibit the synthesis of beta-D-glucan, and this beta-D-glucan is a major constituent of the fungal cell wall. So when Capsofungin inhibit the beta-D-glucan synthesis, so ultimately leading to the inhibition of the fungal cell wall. And how Capsofungin inhibit the beta-D-glucan? By inhibiting the beta-D-glucan synthesis. So this Capsofungin inhibited the beta-D-glucan synthase enzyme, leading to the inhibition of the beta-D-glucan synthase, the beta-D-glucan. And when there is the inhibition or inhibition synthesis of the beta-glucan, leading to the interfere or the inhibition of the synthesis of the fungal cell wall. So that's the general mechanism of action of the Capsofungin. You people should study the diagram, that this is the fungal cell wall. Observe the diagram of the fungal cell membrane and cell wall. So this is the cell wall of the fungus, which made of the protein and chitin layer. This is the protein layer and that's the chitin layer, and these layers are linked together, are connected to each other by the beta-D-glucan. This is the beta-D-glucan, this protein layer, and this is the chitin layer, and attached are linked to each other by the beta-D-glucan. And this beta-D-glucan is synthesized by the beta-D-glucan synthase. So what's actually Capsofungin do? For example, this is echinocandin or capsofungin, micofungin or Anidulafungin. So this echinocandin drug or capsofungin drug bind to the beta-D-glucan synthase enzyme, leading to the inhibition of the synthesis of the beta-D-glucan. So when there is no synthesis of beta glucans in the enzyme, there is a separation of the protein layer from the chitin layer. Or simply you people can say that this link between the protein and chitin layer is disturbed or terminated. So when this connection is terminated, so the protein layer are separated from the chitin layer, and the cell wall of the fungus will become weakened and finally leading to the death of the fungus cell. So that's the general mechanism of action of the capsofungin. And capsofungin are especially useful for aspergillus and candidal infection and not active orally and given IV. Capsofungin are non-active orally. So because of this reason, we can administer the capsofungin through IV route and highly bound to serum protein or plasma protein. So that's the general mechanism of action of the capsofungin. Now move forward toward the ADR and uses of the capsofungin. So ADR of the capsofungin is rashes, vomiting, hypoglycemia, and giant pain. So there's the ADR are side effects of the capsofungin, that capsofungin may produce rashes, vomiting, hypoglycemia, and giant pain. And if we are talking about the uses or indication of the capsopangin, that in which condition we people can administer, we people can use the capsopangin. So capsopangin may be used in deep candidiasis and esophageal candidiasis. So in case of dead candidiasis or severe infection of candida which are resistant to the azole antifungal drug, so in this condition we people can administer the capsofungin. And esophageal and candidiasis are infection of esophagus or pharynx due to the candidal fungus. So in this condition we people can use the capsofungin. So that's a general introduction, mechanism of action, ADR, and uses of the capsofungin. I hope you people will understand and enjoy our today lecture. Otherwise, if you people have any question, so you can ask me in the comment section or in my WhatsApp group. So thank you so much for giving me your useful time. Thanks.